Welcome to Ask Dr. Scott. Thanks for returning once again. Today we're going to talk about infertility. Some ladies had questions about trying to conceive. So we'll just start with the basics. If a couple comes to me stating that they've been trying to conceive for over a year, typically what I'll do is take a thorough history just to find out what's going on with them, starting out with the female partner. And what I essentially want to determine is if they're having regular menstrual cycles. With that, in addition to having regular menstrual cycles, then I want to know, are they ovulating? And once a person has come to me, usually females have downloaded apps, so they're typically tracking their monthly cycle, so they kind of know when they should ovulate. And oftentimes they're checking their basal body temperatures to determine if indeed they're ovulating. So, with that being said, if we determine that they're having regular cycles, they are ovulating, and still not achieving a pregnancy, then I may, at that point, I'll turn to the male partner and find out, if perhaps he has other children or if they've had him evaluated. As a general gynecologist, I can do basics. So once I do basic things, which would simply be to maybe give the woman a pill called Clomid to upregulate or increase ovulation, anything beyond that, I would send them to an infertility doctor. If it gets to a point, if you've tried, let's just start with statistics. Basically, if you're a couple having regular relations on a regular basis, unprotected for a year, about 85% of couples will conceive. After a year, if nothing happens, then as I said, and you come to the doctor, then we go through the course of, I'll do a detailed history and find out those things I just mentioned. Once you do go to the fertility doctor, typically what's going to happen is they will do a thorough history and physical as well. They'll do some blood work with the female, depending on your history. If it needs to be determined if your tubes are open, they may do something called an HSG, which stands for hysterosalpingogram, where they will put a catheter into your cervix and shoot contrast dye into your uterus to see if your fallopian tubes are open. If that needs to be done, then they'll, in addition to evaluating the female, they'll evaluate the male as well by doing what's called a semen analysis. And essentially what that does is to make sure that the male is producing enough semen and that the sperm, they look at the morphology or the shape as well as the number and the movement. So let's say you had a complete and thorough workup. Your tubes are open, you're ovulating, the semen analysis is normal. They may just start with something basic, just called insemination. So typically what will happen is they'll give the female injections, sometimes with a pin that looks similar to this. Okay. And what that does is it upregulates follicles. So you want to recruit more follicles to increase your chance of providing eggs. And then they can do just a simple in-office insemination, an IUI, which stands for intrauterine insemination. And oftentimes that will be enough to achieve a pregnancy. If that doesn't work after doing several sessions of IUI, you may have to move to the next step, where you then do what we call an egg retrieval. So you'll take injections again. They can do an egg retrieval from the female, and they can take and fertilize your eggs outside of the body and then reimplant fertilized egg. So this is a little bit detailed, but I know oftentimes people have questions for their general gynecologist and they may not be able to get to the fertility doctor due to insurance or cost. But at least you sort of have an idea of the steps that are involved. As far as covering the cost, oftentimes people want to know, well, what does it cost? I often encourage people to call their insurance company and see what's covered, because some insurance, depending on your plan, what state you live in, will cover some do not. But as far as out of pocket, it could typically, I would say on average, it's about a $10,000 out of pocket cost. Now, some people are going to say, well, I'm a a woman who's maybe over 35, advanced maternal age, I'm single and I'm interested in having a baby. And maybe they don't have a partner and they may not want to wait. So then we get into talking about alternative ways, or should I say ways that maybe a female would want to try to have a baby and they don't have a partner. Then that just would include something called utilizing a sperm donor. So let's say you're 35 or 40 years old and you're like, time, I'm not married, but I want to become a mother. Then at that point, you would talk to your general gynecologist, who would then refer you to a specialist, an infertility doctor, and you would have options to do exactly the same things I explained. But because if you don't have a partner, you would just utilize a sperm donation, and your doctor can provide you with that information. Questions, concerns? Thank you again. And if you have any questions, please submit your questions and we will address them in the next section of Ask Dr. Scott.